Hi everyone, welcome back to my channel. Today in this video I will teach you about Crimean Congo Haemorrhagic fever. This is a very important disease and WHO also alerted us about this disease. This disease, you can see the picture of a person who is having his left arm which is having internal bleeding. You can see the left arm of this patient. This is a patient from Turkey. He is having internal bleeding. Why this internal bleeding is there? What actually causes it? Everything, treatment, everything I will discuss in this video. So watch the video completely. Now, what is this Crimean Congo Haemorrhagic fever? This Crimean Congo Haemorrhagic fever is CCHF, abbreviated as CCHF, Crimean Congo Haemorrhagic fever. It is a tick-borne fever. Tick-borne fever. Remember, it is a tick-borne fever. Where it can be found? It can be found in Africa, Balkans, Middle East, and Asia. Africa, Balkans, Middle East, and Asia. This virus, which is there inside the tick, that belongs to Bunia viridae, and it is a RNA virus. Now, what is the primary host? The primary host is the zoonotic disease carried by several domestic and wild animals. Several domestic animals like the sheep, like the goat, like the cow, they have this virus. Now, how they get this virus? Because of the tick bite. Because of the tick bite. What is the name of the tick? Hyaloma tick. What is the name of the tick? Hyaloma tick. And from that tick bite, the animals get infected, and from the animal's blood, human get infected. Now, let us learn about the epidemiology. Now, what is the first case? Where is the first case? The first case in India happened in Gujarat in 2011, January month. 2011, January month, Gujarat, first case of this Crimean Congo Haemorrhagic fever occurred, and it is reported in Sanand, Gujarat, India. 4 deaths were reported. 4 deaths were reported. You can look in the right side picture what are the places where it is affected. Now look at this tick. You can see this is a tick. This is the hyaloma tick. This is the tick, and that actually causes the Crimean Congo Haemorrhagic fever. How it actually causes? It contains a virus. It has a virus, and when this tick actually bites the cows or bites the sheep, bites the goats, then this virus which is there inside this tick, it goes inside the blood, and the blood of the animal become infected, and when the infected blood comes in contact with the human also get infected. Basically, the people who are associated with slaughterhouse, they get the infection. You can see Crimean Congo, the group is group V. You can see negative single stranded RNA. Remember, RNA virus told you single stranded RNA, negative. And the order is unassigned. Family is Bunia viridae family. Bunia viridae family. What is the genus? Nidovirus. Nidovirus. Remember, all these are question. Nidovirus, Bunia viridae, negative stranded, Crimean Congo fever. Always remember, negative stranded RNA virus. Now look at this. Arbovirus. This is the chart of the arbovirus. You can see arbovirus can be divided into different viridae like Toga viridae, Flavi viridae, Bunia viridae, Rio viridae, Rhabdo viridae. All these are the different types of the arbovirus. It can be divided. Arbovirus can be divided into all these heads. Now, among it, one is Bunia viridae, and Bunia viridae can also be divided into Bunia virus, Flebovirus, Nidovirus, all these, and Hanta virus. And from the Nidovirus, we can get the Crimean Congo fever. So remember, arbovirus, Bunia viridae, Nidovirus, and then we get the Crimean Congo fever. Now Bunia virus actually belong to the family. The name of the family is the Bunia viridae family. Bunia viridae family. It is a negative stranded, remember this, negative stranded enveloped RNA virus. Negative stranded or enveloped RNA virus. Bunia viridae are vector-borne virus. Transmission occurs via arthropod vector. Its transmission occurred via arthropod vector. Example, mosquito, tick, sandfly, except the Hanta virus. In case of the Hanta virus, they are transmitted by contact with deer mice fishes. Deer mice fishes, they actually get transmitted through the fishes of the deer mice. Now look at this. This is the hard tick. This is hard tick, which is also known as ixodid ticks. Ixodid, DID, ixodid hard ticks. Remember this, ixodid ticks or the hard ticks. They belong to the genus Hyaloma, hard tick, Hyaloma ticks, ixodid ticks, all is the same thing. You can see the picture, they may give you the picture. This is the hard tick, which is the reservoir and vector for the Crimean Congo hemorrhagic fever. Now look at this tick. Can you see the tick? Yes, this is the ixodid tick. This is the hard tick. This is the tick which causes the Crimean Congo hemorrhagic fever. It belongs to the genus Hyaloma. It belongs to the genus Hyaloma. Hard tick. It is not a soft tick. Hard tick which causes the Crimean Congo hemorrhagic fever. There was an MCQ where it was given hard tick, soft tick, whatever you have to choose. Hard tick, ixodid tick, or you have to make it correct that it is hard tick. Remember this. Now how the transmission actually occurs? Transmission occurs to the human beings. We are concerned about the human being, how this virus, it came from, first you have to understand the virus was there inside the tick. It came to the animals through the tick bite, and from the animal how it is coming to the human being, that we are concerned. Generally, if we are slaughtering an animal, then we can get contact the blood of the slaughtered animal and we can get this infection, and we can get human to human transmission also if we come in contact with the infected person's fluid, infected person's saliva, infected person's body fluid. Then we can get this infection also. Or if we travel into a place where the prevalence of where there is this disease, Crimean Congo hemorrhagic fever is prevalent, then also we can get the disease. Now look at the left side of the chart. You can see the tick, how it is having its life cycle. On the right side you can see how it is infecting the cows and the other livestock, and the person who is taking care of these livestock, or the person who is doing the slaughtering of these animals or taking care of these animals, they are actually getting this fever, that is Crimean Congo hemorrhagic fever. Why it is called hemorrhagic? I told you, you get internal bleeding because of this fever. Everything I will discuss, don't worry. Now look at the clinical features. What clinical feature we get? First, let us understand the incubation period. The incubation period is 1 to 3 days only. Incubation period is only 1 to 3 days. Following the bite, after you get the bite, 5 to 6 days after you are exposed to the tissue, you may get the flu-like symptoms. You get the flu-like symptoms. You get headache, you get vomiting, you get diarrhea, you get abdominal pain, you get photophobia, you can get this. And remember, the 40% is the fatality rate of this disease. 40% fatality rate, 10 to 40%. In the WHO website, if you look, it is 10 to 40% is the fatality rate of this disease. What actually happens when you check the patient who is having the Crimean Congo hemorrhagic fever? You can get swollen liver, you can get painful swollen liver, you can get DIC, you can get kidney failure. The person also may develop shock, the person may go into acute respiratory distress syndrome. All these things can be there, and this causes 30 to 40%, I told you, fatality rate. Now what is the diagnosis? How can you diagnose Crimean Congo hemorrhagic fever? Diagnosis is number 1 by ELISA. What is ELISA? You know, enzyme linked immunosorbent assay. Enzyme linked immunosorbent assay. Or you can do the RT-PCR. RT-PCR is the real time polymerase chain reaction, RT-PCR. You can do virus isolation. You can do ELISA, IgM, IgG, detection of the antibody by the ELISA. You can do all these methods. So remember, ELISA, RT-PCR, virus isolation, all these are the method of diagnosis. Now, laboratory diagnosis of a patient who is having the clinical symptoms of the CCHF is made generally during the acute phase. When the acute phase is there, suddenly the patient is developing fever, suddenly the patient is having the flu-like symptoms, suddenly the patient is having headache, abdominal pain, vomiting, then you can do a combination of ELISA, RT-PCR, blood test, different things you can do in combination cases, so that you can understand it better. Now look at the picture. This picture I have selected particularly because this picture is very viral in the internet. Just observe this picture. Can you see? Yes. On the right side, you can see hemorrhage. You can see hemorrhage. Now, what kind of hemorrhage? Is it external hemorrhage or internal hemorrhage? Yes, it is internal hemorrhage. It is internal hemorrhage. You can see the patient is having internal hemorrhage, and that is why, now can you understand why this disease is called Crimean Congo Haemorrhagic fever? Because the person will have internal hemorrhage. Now, is there any treatment? There is no established treatment. There is no specific treatment for the disease Crimean Congo Haemorrhagic fever, but we can give supportive therapy. You know what we give in the supportive therapy? We give oxygen. If the person is having decreased SpO2, we can give oxygen. We can give fluid to correct the electrolyte abnormalities. If the person is going into shock and something, we can also treat with the help of different antibiotic if there is secondary infection of anything. Ribavirin is used during the outbreak. Ribavirin, you can remember the name. Now, is there any prevention? Generally, in WHO website, if you look, you will get that there is no vaccine available. That is written in WHO website. But here I can tell you two important vaccine. One is the mouse brain derived vaccine. Mouse brain derived vaccine. This is the only vaccine that is somewhat efficacious in case of the treatment of the CCHF vaccine, and it is used in Bulgaria. Another vaccine I will tell you, in 2011, Turkish research team that was led by SCS University that has successfully developed one vaccine that is non-toxic vaccine and preventive vaccine, which actually passed the clinical trial, and it was also approved by FDA. Now, this is the end of this video. If you like this video, make a thumbs up and please subscribe this channel. This channel contains so many medical videos. Please don't go without subscribing. I make a lot of efforts in making this video. Thank you so much for watching this video. Have a nice day. Bye bye.